if you all were here last month or watched the replay, you remembered that Karen led us through this wonderful manual lymphatic drainage exercise. But tonight, she said she'll lead us in a diaphragmatic breathing exercise. So this is going to be a really nice way to kind of wind down from the evening. And it's a good tool to have for a little self-care thing you can do too. So Karen, I'm going to pass it over to you to get us breathing.
Great, good. Well, I thought that diaphragmatic breathing would be a really good thing for Mental Health Month, as well as lymphedema, because deep breathing has so many physical and mental emotional benefits. Among them, well, first off, we talked last time about how the lymphatic system does not have a central pump like the heart, but the diaphragm comes pretty close because we have actually seen the lymph flow increase using ICG imaging when people start deep breathing, which is just amazing. And so lots and lots of effects on the lymph system that have been proven many times over. And then in addition to that, there's a whole relaxation response that happens with deep breathing that lowers blood pressure. It lowers heart rate. It reduces the levels of stress hormones in the blood, and it reduces lactic acid buildup in the muscle tissue. So if you've been working out, finishing your cool down with some deep breathing can really help that. It helps to balance the levels of oxygen and carbon dioxide in the blood and definitely improves the immune system, increases our physical energy, increases our feelings of calm and well-being, and everything that I can think of positive, deep breathing really has there. So some of my patients, when they come to me, and by the way, I teach this at the very first visit of every patient because I want to start off with that. And then we practice deep breathing at every session so that we can, remember and link into it. Some people have trouble with that. A lot of people carry stress in their shoulders. And many people, when they breathe, they're actually using the accessory breathing muscles that go up the neck. And so their shoulders are actually going up and down. And the accessory breathing muscles are meant to be used when we're really huffing and puffing so that we can call in extra help. But for the diaphragm, we want to use the muscles in our belly. And sometimes patients have a hard time identifying which muscles should I use because they're so used to using these accessory muscles. So for all of you, if you want to, if you can, I recommend that you lie down, if you have a bed nearby, or even the floor or a couch, or even if you can recline back a little in your chair. It might make it a little easier to get to the tummy because sometimes when we're sitting and we're upright and we're kind of activating all these postural muscles, it's harder to relax. It's harder to get to the diaphragm. So that's number one. Number two is put one of your hands right on your belly button and then put another hand on your heart. Now, what we're going to do is the opposite of deep breathing. I'm going to ask you to breathe out all the air in your lungs. So go ahead and blow it out. And notice that when you take the next breath, it's deeper because you've gotten rid of so much of that air that's in there. So try that again at your own pace. Go ahead and just do a big, huge exhale and exhale every single bit of air that you possibly can. And then breathe in again. And it feels so good to breathe in after you've had a big exhale. breathing can be very pleasurable. So now let's look at your hands or feel your hands and just take some normal breaths and notice if the hand on your belly button is moving at all. Because when we breathe using our diaphragm, it actually pushes our hand up and down. So as you breathe in, you should be pushing out and your hand should be pushed away from your body. And as you exhale, then your belly collapses and the diaphragm shifts so that your hand moves in towards your body. So just play with that a little bit and kind of get curious. And if you want to get really tricky, you can start by breathing everything out. And then with your next breath, feel your tummy rise and then let it continue into your chest so that your tummy fills up and then your chest fills up, and then let it all out. So there are some great teachers who teach different ways of breathing. Kathleen Lisson is one who comes to mind, and she's done some really wonderful webinars for LymphaPress. If you Google Kathleen Lisson and LymphaPress, you'll find her. And she has all kinds of resources for stress reduction. I mean, talk about mental health. That woman is a treasure. But she also has a lot of ideas of ways that you can count while you breathe. And I'm going to teach you one of them. And this is called square breathing, which I learned from Andrew Weil. And so basically it's breathing in for a count of 4, and then holding your breath for a count of 4, breathing out for a count of 4, and holding your breath for a count of 4. And when I say hold your breath, it just means that you're neither breathing in or out, you're just relaxed. So try that at your own pace as you breathe in, 2, 3, 4, and hold, 2, 3, 4, and out, 2, 3, 4, and hold, 2, 3, 4. And you may want to do it a little faster or a little slower than the way that I'm counting. But that's something that I personally use. If I wake up in the middle of the night and I'm having trouble getting back to sleep, I use my breathing techniques because that is very effective for me, just to relax a little. So these are just a few little tips for helping your lymphedema, helping your stress, helping your general mental and physical health. And I think that the more that you can remember to focus on breathing, the better your life will be.
That was so relaxing. Thank you, Karen.